Health and Wellbeing Program is continuing its commitment to help our community and raise awareness on various health issues. We are doing these programs since 2019, and we still continue on most monthly basis. We do have for the women only programs for health and well-being, but arthritis is one of the common problems which affect both men and women, and even children with wide age range, and it can severely affect on the quality of life. We are very lucky to have Dr. Behram Khan to deliver talk on arthritis and give us some helpful tips for our community. Dr. Behram doesn't need any instruction. He's an experienced rheumatologist. He has extensive research, particularly experience in the Asian patients with arthritis. So without a delay, I will hand over to Dr. Behram Khan to start his talk, please. Thank you.
Thank you, Dr. Tariq, for that lovely introduction. So, first of all, good evening, Assalamu alaikum, and Eid Mubarak to all.
Yes.
So, as Dr. Tariq mentioned, my name is Behram Khan, and I'm one of the rheumatologists currently working at the Kelpin Center for Rheumatology and Manchester Royal Infirmary Hospital. I think it's a very good thing that the 3M Foundation is doing, trying to encourage health-related topics and set presentations. So I have no disclosures. So what I've tried to do is keep my presentation as simple as I can. And there will be a lot of slides, pictures, and maybe a video at the end. I'm more than happy to take the question as I go along, or at the end as anyone suits to anyone. So, and please interrupt if something is not clear or my voice is a bit fast. So what is arthritis basically? So basically arthritis, it's a condition that causes pain and swelling of joints. And as you would appreciate, arthritis is not just a single entity. There are many types of arthritis. And I'm sure you'll appreciate it's very difficult to cover arthritis just in 1 hour session. So what I'm going to do is I'm just going to, some of the people are talking between. So I think what I'm going to do is I'm just focusing on two main types of arthritis that's quite commonly encountered in our clinics in Asian communities and in the UK as well. So I'll be talking on that only today. So just to give you a quick idea of how a normal joint looks like, can you see my cursor?
Yes, we can see your cursor easily.
Right.
Yeah.
Excellent. So just to give you an idea how a normal joint looks like. So you can see that this is a bone, normal bone, and this is a bone. So this is a joint in between the both bones, and what's happening is this: you see there's a joint capsule that's covering both the joints to make it stable, which is followed by a synovial membrane. And basically, the job of this synovial membrane is to secrete some fluid so that it prevents the friction or resistance between the two joints. And you can see that the joint is covered by a lining in blue. This is known as cartilage. The function of this cartilage is to prevent bone rubbing against each other. And you can see the muscle, which continues as a tendon and gets attached to the bone. And all of this is very important for the normal stability of a joint. So this is how a normal joint looks like. Now, arthritis, as I just mentioned, that there are many types of arthritis. So broadly speaking, one of the commonest arthritis that we encounter is inflammatory arthritis. And I'm going to mention some of their most common types. Osteoarthritis, many of you might know about osteoarthritis. It's usually, some call them wear and tear arthritis, some call them it's age-related. As you get older, you get osteoarthritis. And septic arthritis is the other type. This is the only type of arthritis which is a medical emergency. You have to attend the A&E or see your GP urgently. Usually patient, they might have had some sore throat, some viral illness, and then they develop red hot swollen joint. So if anyone has any red hot swollen joint, they are having temperature spikes, that is a medical emergency. They need to see their doctor straight away, because we know that if patient develops septic arthritis, if they are not treated promptly and urgently, they can lose their joint. So broadly speaking about inflammatory arthritis, many types of inflammatory arthritis. The most common type, I'm sure many of you must have heard about it, is rheumatoid arthritis. very common in our community and common in the UK setting as well. Then psoriatic arthritis, crystal arthritis, ankylosing spondylitis. This is usually basically inflammatory arthritis that particularly affect young population, usually less than 45 years of age. They present with back pain, and particularly this pain is quite worse in late night, early morning, and it seems to improve with activity. And then some patient may have underlying inflammatory bowel conditions like Crohn's disease, ulcerative colitis. They go on to develop intrahepatic arthritis. Now, crystal arthritis is further subdivided into two main types. I'm sure many of you might know about gout. It's basically raised uric acid. What happens is that it starts to make crystals and they start to develop deposit in joints. And pseudogout is basically calcium deposition within the joints. Today, we are just going to focus on two main types, osteoarthritis and rheumatoid arthritis. A nice picture just to give you a brief idea how the osteo and rheumatoid arthritis differs from normal joint. So if you see osteoarthritis, what has happened is that if you see here, there's a good cartilage lining, while in osteoarthritis, the lining, the cartilage is completely gone, and the bone is rubbing against bone. This I'm going to tell you later on about it, why do people have osteoarthritis and how to manage that condition. While in rheumatoid arthritis, you can see the patient has got cartilage, bone is okay, but there's swelling of the synovium that is covering the joint. And we'll come to in a minute why people develop these conditions. So why arthritis is important and why we are talking about it? Because it is one of the biggest cause of disability in the UK. It affects almost every age. It's particularly common in elderly population. About 7 million adults in the UK, they have health-related condition which is directly related to their underlying arthritis. 9 million people visit GP every year for arthritis-related conditions. So you can get a overview and an idea of how big impact this condition is having on not only on the health but also on the UK economy. It is the second most common cause of days off work in both sexes. And around 2 million adults, they consult their GPs for osteoarthritis related problems every year. So it's causing having a huge impact on NHS. Now, if you forget rest of the arthritis, just broadly speaking of the two main common types, osteoarthritis and rheumatoid arthritis, it's causing 10.2 billion pound of expenditure to the NHS, and it is expected to soar to 118 billion in next decade. So you can very well imagine how big impact this arthritis is having on not only on the health but also on economy as well. And due to the better treatment that we have these days, due to the increase in life expectancy, the more we grow older, the more people are getting arthritis. So it's just a nice slide showing that the more we get older, the more risk of getting arthritis, and again causing a lot of mental and health issues as well with it. So if you just think in 2017, about 195 million pound of prescriptions were dispensed by GP for joint related conditions only. So now coming to our main topic of rheumatoid arthritis. So what is rheumatoid arthritis? So basically what happens is normally if we get for example, if you get a flu-like illness or any illness, what happens is that your immune system, it gets activated and it tries to work against the foreign invasion by viruses, the bacteria, try to kill it away and just get rid of it. Now, for some reason, what happens in rheumatoid arthritis is that your immune system, it becomes overactive. So we do not know the specific cause. There are many reasons which I'll come to in a minute, but what happens is that due to overactivity of your immune system, it starts to attack the organ within your body, particularly your joints. And if it is not treated, it does not stay and affect your joint, but it starts to affect other organs like your eyes, your heart, your kidneys. So basically, it's a normal immune response. It's directed against individual own tissue, and it includes the joint, tendon, bones. And what it causes is the inflammation. It starts eating away the bone and causes destruction of those tissues. in this condition, what happens is basically patient will present with joint which are quite painful, they are stiff and they are swollen. And if the inflammatory condition goes on, it will lead to irreversible damage. A very beautiful picture just to give you an overview of what's happening in rheumatoid arthritis. Basically, due to active immune response, what's happening is there's a lot of inflammatory cells. Now you can see all of these inflammatory cells. Now they have ended up here and they are eating away the bone, the cartilage. It's inside the synovium, and this is what is rheumatoid arthritis, and this is what is causing the pain, the swelling, the fatigue, the stiffness. Now, what causes rheumatoid arthritis? So there is no single entity that can be pointed and we can say that this is the cause, and if we target this, you will not have rheumatoid arthritis. So what we know is that it's multifactorial. There are many risk factors that are associated with arthritis. So the common risk factors is age. We know that this condition is more common in 4 to 6 decade of life, and it peaks in the 7th decade. It's more common in female. We know that it can run in the families. There are various genes that have been identified in the families that makes a person prone to developing rheumatoid arthritis. One of the commonest genes is HLA-DRB1. We know that smoking increases the risk of rheumatoid arthritis. Smoking causes production of certain antibodies, which increases the risk of rheumatoid arthritis. So a male smoker is twice as risk of developing arthritis as compared to a non-smoker, while in female it's about 1.3 times higher. We know that if you are overweight or obese, your risk of getting or acquiring rheumatoid arthritis is very high. If you are just overweight, the risk increases to 15%. But if you are obese, your BMI is over 30, your risk goes further higher to 31%. No. So what are the clinical manifestation of this disease? Patient usually, they will develop new onset of joint pain, joint swelling, and joint stiffness. And this usually persists over 6 weeks. So why we are demarcating it at 6 weeks is because sometimes with some normal cold flu symptoms, you might have a flare of joint pain or joint swelling. It usually settles within 6 weeks and it does not need any treatment. But if any joint pain, joint swelling, stiffness, it persists over 6 weeks, this needs to be treated aggressively. And I will come to that in a minute why. Again, as I said, it's usually common in 3rd to 6th decade, more common in females. So the patient may present with persistent joint swelling that's not responding to simple analgesia, or they may have episodic swelling. For instance, they had swelling in their right hand, which has settled, and now they have developed swelling in their left knee or left ankle, and so on. In terms of rheumatoid arthritis, it can affect any joint, but for some reasons, it loves to affect usually the hands. And in the hands, if you can, particularly, it affects the metacarpophalangeal joint, that's the knuckles, and the middle joint of the finger, that's called proximal interphalangeal joint. So mainly it affects the metacarpophalangeal and the proximal interphalangeal joints. Usually patient complains of early morning stiffness. So when they wake up in the morning, they struggle to get out of the bed. And this stiffness usually lasts over 30 minutes, on average at least 1 to 2 hours. So it will be at least 1 to 2 hours before they will be able to do their daily. Sorry? I thought I heard a voice. Anyway, continuing on.
It was by mistake. Sorry, sir.
Sorry. So apart from morning stiffness, patient will also experience constitutional symptoms, like they will have fever, they will feel fatigued, tired throughout the day, they will feel very weak, and this is all because of the inflammation that is going on, and they will have loss of appetite. They usually they have some response to anti-inflammatory, like ibuprofen or naproxen. And you can imagine this inflammatory cells that are circulating, they do not only just go and stick to the bone, but this inflammatory cells can affect any organ of the body. It can go and affect the eyes, it can affect the kidneys, the lungs. And this is why it is very important to pick up these cases early. There's very robust evidence now that if we pick up these cases early and then treat them aggressively, we can halt their disease, which will prevent subsequent damage and long-term morbidities and other problems that comes with the treatment and with the disease itself. And that's why now, these days, we have set up early arthritis clinics. So where we see such patient immediately within a couple of weeks' time, and we treat them, and their disease goes into remission. And by remission, I mean that they don't get those joint pain and swelling, and they remain stable. A very nice picture of a patient who has rheumatoid arthritis. You might be able to appreciate a bit of swelling in the knuckles, but these swellings are quite evident. These are the proximal interphalangeal joints. And as I said, the rheumatoid arthritis, basically, it's more common to affect the hands and small joints. And you can see the swelling very nicely. A very nice, beautiful X-ray of one of our patients. And you can see, if I show you a normal bone, so you can see a very nice outline, crisp bone outline. And if you come here and if you follow my cursor, you can see there's a punched out lesion over here. And this is what we are trying to prevent. And this is why we these days see this patient urgently, because if you have got this bone has been eaten away by the inflammatory cells, and this, in medical terms, we call them erosions. Once you develop erosion, these are permanent. No treatment will work on this. And why we want to prevent these erosions, I will come to that in a minute. So what is the goal of treatment in rheumatoid arthritis? Early diagnosis is the key these days. Patient education is very important. So we know from literature that if patients know about their condition, if they know when they need to contact the rheumatology or the GPs when they are having a flare, or if they have got persistent swelling, and what sort of treatment they need to take to help them settle their flare. So this not only improves their rheumatoid arthritis, but it also have a good impact on their overall health and mental well-being. The target is to control the pain and disease activity. Why it is important to control pain in such arthritis patients? Because imagine if you are having a pain in your wrist, you are not moving your wrist. So what happens is, because of pain, you are not moving your wrist. So you can imagine that the muscles are attached to the joint as well. These muscle gets wasted. So we call them as disuse atrophy. And this adds to the further burden, and you'll get further pain and deformity. This is what we try to prevent. So it's very important to get on the top of pain. And this will prevent disability and damage. And our target is to basically suppress the inflammation. So rheumatoid arthritis, we can control the inflammation and suppress the inflammation. It is a controllable disease, but this usually stays with the patient lifelong. We cannot reverse the condition. Most of the patient will need some sort of treatment lifelong. And as I mentioned, why we try to prevent erosions? Now, this is the reason. You can see, some of you might have seen patients, especially the grandparents, because in 3 decades earlier, there was no good treatment. So what happened is that once you get erosions, your finger, they start to bend, and you can see these fingers are just bending towards one side. And you can imagine the impact that it is going to have on this patient in their day-to-day activity. And not just an impact on their hands and day-to-day activity, but on the mental and physical well-being as well. So this is what we are trying to prevent. So what about treatment? So non-pharmacological, so physical therapy is the key. So we advise the patient that they need to keep themselves as active as possible. There's a lot of research and a lot of robust evidence out there which suggests that patients who have got some sort of arthritis, they need to keep themselves as active as possible. And I will come to that in a minute. Sometimes these patients need to see occupational therapists for splints. For example, I show you the previous slide of X-ray where the patient's got deformity, where their hand is tilting away on the other side. Imagine if this patient has to chop the food or use the fork. It will be very difficult. So they need some sort of splint and assistive devices for day-to-day activity. Smoke cessation is the key. Weight reduction is very important, because we have seen in our day-to-day practice that if we are able to reduce, if the patient is able to reduce their weight, who has got arthritis, they are going to get on top of their condition. I'm sure many of you would be thinking, what about diet? What kind of diet we should be taking? so that we don't develop such arthritis, or how to get on top of our condition with diet. And we get these questions in our clinic daily. So just to tell you, there is no robust evidence which favors one type of diet on other. What we know is Mediterranean diet, which I'll tell you what is a Mediterranean diet in a minute. There is some evidence which shows that Mediterranean diet is very helpful in such patients. It not only lowers your blood pressure, it protects you from chronic conditions. It helps your arthritis by curbing the inflammation. It's good for your heart. And this diet helps to help you to lose weight. And if you lose weight, you can imagine you'll have less pressure on your joint and the inflammation will be low. So it will help your joints overall. And this is a very beautiful picture of a Mediterranean type diet. So basically, this is a pyramid, and basically what it says is that you need to keep yourself active, have a healthy meal. And by healthy meal, I mean take a lot of fruit, take vegetables, olive, nuts, fish, and a recommendation is that you take poultry, eggs, chicken, dairy product once or twice a week, and try to minimize your use of red meat. So we know that people who take a lot of red meat, lot of sweets, and a lot of junk food, so their risk is quite high of getting any kind of arthritis. So, if you follow the Mediterranean diet, this is going to help with the arthritis overall. What about medications? So rheumatology has rapidly advanced in the last 3 decades. 3 decades ago, we had limited medication to help such patients. It was just painkillers, a bit of steroids, or hydroxychloroquine. But in the last 3 decades, we have got very robust medications. I'm not going to go into detail of what kind of medication we give to patients, but I'll just give you a summary and overall view of it. So normally, if someone has got an ongoing arthritis flare, so what we suggest is they can have short course of naproxen or ibuprofen because they are anti-inflammatory, they suppress the inflammation, and that's helpful. But this is going to be a short-term measure. If someone has got a short-term flare, or if we diagnose a new patient with rheumatoid arthritis, initially we give them steroids, and that's for short period only. And the reason we give them steroid is because it acts quickly within days, and then in long term, there's something we call disease-modifying anti-rheumatic drugs. I'm sure some of you might have heard the name methotrexate. It's commonly used. There are other DMARDs as well that we use. And then if someone fails on DMARDs, then we go to very strong medication. These are known as biologic agents. They've got a very strict criteria by NHS for patient to qualify. And we have got so many patients, and they're doing very well on it. And these DMARDs and biologics, they are very strong medication. They suppresses the immunity. So we very frequently monitor this patient. They need to have very regular blood monitoring. And they need to stop this medication if they develop any sort of infection, because you can imagine this medication, basically what it is doing is trying to suppress the inflammation and the immune response, the overactive immune response. So if you've got an infection, your immune system is further dampened. So if you are on this medication, then there's a risk that you will go into very nasty kind of infections. Now, we know that about 68% of the patients who have got rheumatoid arthritis in the UK are physically inactive. And this leads to a vicious cycle. Inactivity, it increases the pain, and this affects your joints, the mental and physical well-being. So that's why we always encourage our patient, and our physiotherapists encourage our patients to keep themselves as active as possible. We know that such patients are at high risk or at very increases of having anxiety and depression, at least twice as likely. And depression is 4 times more common among people in persistent pain compared to those without pain. So what should you do? Keep yourself active as much as possible, sit less, try to move around, build strength by doing exercises, going to gym, yoga, and improve your balance. So you can go on walks, you can go running, play sports, use bicycles. And given how busy everyone is these days, so it is, if someone can do regular exercise, that is excellent. If someone struggles, then at least the evidence suggests that at least we should be doing some sort of exercises at least twice a week. That was all about rheumatoid arthritis. Happy to take question, and I'm happy to proceed as well. So going on now, osteoarthritis. So I'm going to talk a brief on osteoarthritis. As you may have heard, sometimes it is referred to as wear and tear arthritis. Now, in osteoarthritis, if you can follow my cursor, you can see this is a normal knee joint with the bone and a nice cartilage, nice shiny cartilage here. Now, if you see what's happening in osteoarthritis is that the cartilage is getting thinner and thinner. And as a consequence, a stage will come where the bone will start rubbing against the other bone. So basically, it's a combination of breakdown of the joint and the body's attempted repair process. Knee is the most common site, followed by hip, hand, and wrist. And approximately 1 in 5 adults over 45 in the UK have osteoarthritis of the knee, while 1 in 9 suffer with osteoarthritis of the hip. Osteoarthritis, basically, it affects weight-bearing joints, particularly the knees, the hips, feet. It also affects the small joint of the hand, but you would notice that it particularly affects the distal joint. This is the proximal and the distal interphalangeal joints, while rheumatoid particularly affect the metacarpophalangeal or the knuckles. And hand osteoarthritis is particularly more common in those people whose occupation involve a lot of hand work. Again, in terms of osteoarthritis, about 18% of people who are over 45 have osteoarthritis of the knee. 33% of the patient over 45 age seek some sort of treatment for osteoarthritis. So what causes osteoarthritis? There are certain risk factors that put you at increases of getting osteoarthritis. We know the more you get older, the more likely you are going to encounter osteoarthritis. If you are in 6 or 7 decades, the chances of getting osteoarthritis is 27%, and it increases to 44% by age 80. So you can very well imagine almost everyone is going to get some sort of osteoarthritis as they grow older. We know that it is more common in females. Again, if someone is overweight, someone is obese, it increases their risk of osteoarthritis by 4-folds. And why it is important? Because UK has the 8th highest prevalence of obesity in the world. So many of those patients who are obese, they are getting osteoarthritis at a very young age. And the way forward for such patients is to reduce their weight, which will have a good impact on their joints. Osteoarthritis is also common in some occupations, especially hand osteoarthritis is common in manual workers like laborers, the florist, or secretaries who do typing. So it is common in these categories. Hip osteoarthritis is common in those occupations which involves a lot of prolonged standing and lifting, while knee osteoarthritis in squatting and kneeling. We know that osteoarthritis can run in the family as well. There's a 60% chance that the offsprings will have osteoarthritis if their parents had osteoarthritis of the hip, while 40% if they had osteoarthritis of knee. How do this patient usually present to us? Again, they will present with painful joint, which increases with activity. Now, they will have morning stiffness, but this morning stiffness lasts just for minutes, couple of minutes, like 5-10 minutes, usually less than 30 minutes. While in inflammatory conditions or rheumatoid arthritis, it lasts for hours. They can have occasional swelling of the joint, but these joint swelling are very different to the inflammatory one. These swelling are more bony swellings. I will show you a picture in a minute. They do get some relief with analgesia. A very nice slide of a patient who suffers with hand osteoarthritis, and you can see there is some joint swelling here, and you might appreciate that this is not soft tissue kind of swelling that I showed you in the picture, previous pictures. It's more like bony swelling, and they've got particular name. these joint swelling, they are known as Bouchard nodes, and if you've got some swelling around the distal one, they are known as Herberdens nodes. A very nice X-ray to show you how osteoarthritis looks under X-ray. So this is a normal joint, very nice bone, and there's a gap between the bone. This is your femur, and this is your tibia. So this is a knee joint. While if you see this patient, the cartilage is lost and the bone is rubbing against the bone. So this is osteoarthritis. How to treat osteoarthritis? So non-pharmacological approach. Again, very important that the patient know about their condition. Weight reduction is the key. Smoke cessation. And we encourage mild to moderate exercises daily. It's important to note that patient who has got osteoarthritis, because many myths, patients think that, oh, they've got arthritis. If they were to do exercise, their joints are already damaged. So further exercise will lead to further damage of their joint, which is wrong. So mild to moderate exercise will never wear the joint out. In fact, it's good for the cartilaginous nutrition. And as I explained previously, the main problem in osteoarthritis is that there's loss of the cartilage that prevents the bone from gliding against each other. Physiotherapy is very important in such patient, and we refer such patient for physio. Patient can self-refer them as well, and they can go through the GP as well. Occupational therapy is very important. Now, keeping physically active is very important for arthritis-related condition. So if someone does regular physical activity, we know that hip and knee osteoarthritis pain can be reduced by 6%, joint and back pain by 25%, just with exercise, just with gentle exercises. Depression is reduced by about 30%. It's a huge number. Hip fractures reduced by 68%, and falls are reduced by 76%. One of the major cause of admission to hospital in elderly population is falls. So if such patient, they do regular exercises, that strengthens their not only their bone but their muscles as well. And the last point is very important, that lack of physical activity is causing the NHS about 0.9 billion a year, which is a good amount of sum. Now, in terms of treatment of osteoarthritis, there's very little in terms of pharmacology that we can do, because this is an irreversible condition. Once you develop it, the focus is just to prevent further damage or further destruction. So some patients find paracetamol helpful. Sometimes patient can have a short course of ibuprofen, and sometimes we recommend Voltaren topical gels to help with the pain. If the joint is severely, very badly damaged, then sometimes surgeries can be considered, and we refer them to joint surgeons. Very nice diagram which showing a knee replacement. You can see this is a prosthesis or a joint replacement of the knee, nicely replaced here. And in X-ray, this is how it looks. This is your bone, and this is the knee joint that is replaced. It is very commonly done these days, and it has got good successive rate. Hip replacement is very common these days and very effective. And you can see this slide which shows us hip replacement here. But bear in mind that this replacement takes place only if all the other option has been exhausted, and this arthritis is having a significant impact on their life. Now, when should you see your GP for arthritis? If you develop a new joint swelling that lasts over 4 weeks, you have tried paracetamol, ibuprofen, and you're still having symptoms, you should see your GP, because these need to be referred to the rheumatology for review. If you have early morning stiffness that lasts at least over 30 minutes, if you are young, less than 45, you have developed some back pain, which is improving with activity, and it's worse towards the end of the day, particularly you wake up in the middle of the night, so you should see your GP. If you've got a history of psoriasis, it's a skin condition, and now you have developed new swollen joints. So this means that it's likely that you have developed what is called psoriatic arthritis. You need to see your GP. If you are having ongoing symptoms, which is not responding to the over-the-counter paracetamol, topical gels like Brufen gel, Voltaren gel, you need to see your GP. If you struggle with activity of daily living, if it is having an impact on your physical, mental, and well-being. Now, if you've got osteoarthritis, and now you have noticed that your joint is giving away or it is getting locked when you walk, you need to see your GP, because this is the point where you should be referred to the surgeon to see if you will qualify for a replacement. Again, there is an NHS criteria, and then you have to be otherwise fit for a replacement. The last one is again very important. If for unclear reason you are unwell and now you have developed red hot swollen joints, you are having temperature spikes, you should straight away attend the hospital, A&E, ED casualty, or see your GP urgently, because this needs aggressive treatment. What about physiotherapy? So physiotherapists, basically, they are professional which help you, teach you about some exercises which are relevant to each and individual person, so that you can do your exercises, and this will help with the pain, the swelling, and overall physical and mental well-being. So they educate, they help you in managing pain and other ways to manage your arthritis. They usually test muscles and power and direct specific exercises towards your muscles. They do assessment of posture, measuring joint movements, and gait analysis. These are all very important to analyze, because it might be that you are having some back pain, and it could be that your gait is, it needs a bit of adjustment. Your insoles might not be proper, or you might not be wearing proper footwears. So they look into it, and that could be the cause, rather than particularly your back pain. So what are the goals of physiotherapists? So basically, their target is to prevent further damage by exercise programs. They help you increase flexibility and help through the exercise to improve and strengthen your bones. They work along with the patient in improving their general fitness, and they provide targeted exercise regime. It's difficult to share all the exercises. So what I've done is I've put some slide of specific exercises. For knee exercises, you can see in this diagram, this is knee stretching, where you stretch your knee till it reaches the chest and keep it there for a few seconds, and then straighten it up. And this is a quad exercise where you place a tissue or towel beneath your knee, and then you try to raise your leg above, keep it there for a few seconds, and then alternate with the other leg. And straight leg raising test, and the other one is cross leg. So these are very simple exercises that everyone can do daily at their home, especially if someone has got knee osteoarthritis. And it takes 5 to 10 minutes only. I'm sure everyone can spare 5 to 10 minutes. Some picture of step up exercise and knee squat exercise. Some common back exercises, again, stretching your knee to the chest level, knee squatting, and half push-ups. These are good for the back. And knee rolling, again, very helpful for the back. And these are arching and hollowing exercises. What about occupational therapy? So who are occupational therapists? Basically, these are professionals which help you to manage your arthritis and your day-to-day activity problems. You might be struggling to unscrew, open a door, use a fork. So these are people who help you with your day-to-day activity. You might be struggling in your washrooms, so they come and review your washroom and recommend some adjustment because of your arthritis. So, for example, you might be working you need adjustment to your chair or your desk. You might be driving, you struggle to steer the wheel, so they might help you with splints, with some gadgets, and so on. They usually provide customized splints to support your joints while you are working or resting. And they recommend gadget according to the patient need. A beautiful picture. This patient struggles to open jar, so she saw the occupational therapist and she has given her a gadget, and now she can easily open the jar. The next patient struggle using their hand due to osteoarthritis of the carpometacarpal joint, which is again one of the common osteoarthritis commonly affecting the joints. So once the occupational therapist provided a customized splint, this patient was able to do their day-to-day activity. And sometimes you can have ongoing pain in your feet, in your ankle. And you can see in this patient had a deviation of her feet toward one side, and this was birth related. This patient was born with this. So just by providing a proper insole, you can see it's a bit thick on one side and thin on the other side. This has offloaded the pressure that was causing the pain and swelling of the ankle. So occupational therapy plays a vital role in helping manage such patients. So what are the top tips to manage arthritis? So I would say stay active as much as you can. Take a balanced diet. Take a lot of fruits, vegetables, milk, yogurt, and try to drink as well as much as you can, at least 1 to 2 liters a day. Try to maintain a healthy weight. Good posture is important. Avoid very strenuous exercise, especially if you've got arthritis. Do not go for very heavy exercises and try to lift very heavy weights in the gym. No, try to do gentle exercises. And it's important that you control your pain. If you're having problem with your pain, you've got arthritis, and the over-the-counter medication is not helping you, then get in touch with your GPs. Or if you follow a rheumatology department, get in touch with them so that they can help you with pain management. And sometimes we do struggle because we are not very experts in pain management. Then what we do is we refer to the pain specialist people. They are specific pain specialist clinic. So they are reviewed there, and according to their underlying other medical problems, they are given some painkiller that suits them. If you feel that you need splints, assistive devices, gadget aids, get in touch with your GPs. Or you can also refer yourself directly to occupational therapist or physiotherapist. So there's a self-referral which you can easily Google online, and then you can refer yourself. Towards the end, I think I would like to play this a very nice video. I hope this works. Let me see. It's just a short video, about 1 minute. I think it's loading. Okay. That's not working.
Can you try clicking on the image, please?
So let me try now. Oops. Oops, this. I think it's not working.
Try going back to the presentation mode, please. Yes, now
Yeah.
click on the image.
Oops. Okay. Oh, it's just disappeared.
Probably it is just an image, not a movie clip that you have included there.
Can I play in this mode?
It appears it's not an image object, but just a screenshot.
Oh, I did play it before the presentation. It was working absolutely perfectly fine.
That's all right.
Oh, shame. It was a nice video on arthritis, how the physiotherapy are helping patients with arthritis. Okay, so we'll just go ahead. Oops, my presentation is stuck now. So let me just, right. Okay. So there's a lot of information out there. What sort of exercise you should be doing. So the best one or the most authenticated one that we usually recommend our patient to go and visit is versus arthritis. If you go on versus arthritis, you will find a lot of literature and very easy instructions to follow on different exercises of your ankles, knees, elbows. So I would recommend all of those patients who've got some sort of arthritis to visit versus arthritis. I've got further very useful links that I'm happy to share after my presentation. I can share with Dr. Tariq and then he can circulate to the participant. Some of the videos are from our Manchester Royal Infirmary Physiotherapy Department, very excellent videos and very gentle and light exercise that you can do. Some videos on Pilates and Tai Chi exercises as well. Because these videos are quite long, so I did not felt that I should play them. It's about 30 minutes and 40 minutes. And because of the time, I think we should carry on. And I think at the end, my presentation will not be complete unless I say a few words about the good initiative Dr. Tariq and 3M has taken in trying to keep their community active as much as they can. And I know that they are trying to, they try to arrange regular men's walk as well as dedicated ladies walking. So I would recommend and encourage everyone to try to spare some time whenever they can and go, because we all know that if you go and walk out in a community together, it does not, it's not only going to help with your joints, you will feel better, your mood will be better, you will overall you feel you are doing much better. And as Dr. Tariq said, I'm doing a research on especially on Asian communities. Why do they not do much exercise? What's the reason? And we are doing a lot of interviews these days, and one of the common theme is that it's cultural, and then they don't like to do exercise alone or at home. If they was if they had the opportunity to come to a community center or to a masjid where they can see other people doing exercises, they will feel more encouraged. So we are doing some research on it. Hopefully, and you can read it later on once it's published, but it's still ongoing. At the end, I would like to thank 3M again, and I'm happy to take any questions if you have.
I think it was very informative talk, and mashallah, you have covered all the topics. And with the exercise we are doing with, I think the ladies walking exercise is more regular as compared to men, and they are winning, and most of the time they are at least 6 or 8 or sometimes even 10. So I think they are ahead of us, so we need to do, and men to do a bit more.
Yeah, I hope after this presentation, people will feel that they need to do some exercise, or they are going to end up having some sort of arthritis.
Absolutely.
Yeah.
So some people, one question from my side is that some people always have this question really in the mind that how to start really, because the reason what they come up with is I have a pain and I can't do the exercise, but it's just very difficult situation. But if you don't walk, you're having some more problem, or don't do exercise you have. Is there any particular way they can step up their things, or any exercise pattern they go, or any?
So normally, yeah. So thank you. So I mean, normally we recommend that they like I mentioned, if they go on versus arthritis website, and if they've got, for example, they've got knee pain, so it shows very nicely how to gradually build up your exercises. So you have to go slowly, like for in the first day you do for 2 minutes only, then gradually build it up for 5 minutes, 10 minutes. And,
yes.
and if you're still struggling and you think you can't do it, then that's the point you need to see a physiotherapist, because they are going to guide you towards a dedicated exercise regime for that individual. So that is very important. So if they have tried painkillers, they've tried exercises that has not helped, then they can probably self-refer to the Manchester physiotherapy team, or they can ask the GP to refer, and then gradually build it on, and they don't need to rush.
Fantastic. Anybody have any question, they can put it on, or they can unmute their mic and they can ask the question, if any. And I think you have touched on the reducing the weight, and I think that is very important aspect. We did cover the community talks on the exercise, and also on the diet, because I think, particularly in osteoarthritis, it's a major factor.
Yes.
And if they reduce the weight, and it also, I mean, when we're speaking to our orthopedic colleagues, and one of the things they usually come up with it is that they can't do the joint replacement if they are
No.
overweight.
Yes.
So that is also a very limited thing. So I think it's very important. You highlighted very nicely with the Mediterranean diet. But I think diet, whatever it is, if you're taking a balanced diet and not overeat, I think that will maintain
Yes.
your weight.
Absolutely. And there are many patients that we see in our clinics. They were obese and they had this either osteoarthritis or rheumatoid arthritis. And when they worked on reducing their weight, their disease is just going into remission. They don't have any more joint pains or aches, things like that. And they're leading a quite good life actually. So it's very important, especially as I mentioned in UK, it's about 6 to 8 on the world. If you see the obesity list, so we are in top 10s. So
Yeah.
you can very well imagine the impact it is going to have on joint-related problems.
We have Dr.
Behram?
Shahid as well. Any questions from Dr.
Yeah,
Shahid?
yeah, just
I think
yeah. Behram is my very good friend. So Behram, I could have asked you in person, by the way, but I want to ask about these crab bandages and knee support bandages, and also what do you think of these NSAID ointments? How effective are these NSAID ointments, and how effective are these crab bandages and knee support
yes.
bandages
So
commercially available over the counter?
yes, thank you, Shahid. Right. So yeah, absolutely. I mean, not just scrub band. I think because if you've got some joint aches and pains, and you're struggling with the mobility, so just to give it a bit of support, so the crab bandage it does help, and especially with the splints, because if you're having any symptom, it leads to joint instability. So all of and that causes, and the instability is causing more and more pain, and it's affecting your joint further. So the role of splints or the crib bandages to give you stability so that you have less pain and you can keep your joints or more active. So it has got a definitive role. In terms of the topical gels, they are definitely effective. So ibuprofen and Voltaren gel, they do help. With osteoarthritis, they do help somewhat, but then there are other topical gels that is not over the counter. A specific one I will mention is capsicum cream. It's made of chili. It's a very good potent gel which helps reduce the pain. So they do have a role. Now some patient might find it very helpful and their symptom might settle, and some might need oral tablets. So it's very variable. So it's very difficult to pinpoint which patient are going to find them beneficial, but they do help.
The
And
other question.
especially if you think like you are a gastroenterologist, you see. So if patients got a peptic ulcer, so we can't give them ibuprofen or naproxen, if they had a bleed in the past. So such patient, they might find the patches or they might find this gel helpful.
Yeah.
What about these food supplements like glucosamine and chondroitin sulfate and the other lot of vitamins being marketed
Yes.
particularly for osteoarthritis?
Excellent question, Dr. Tariq. So NHS is very clear, and there's been a good research on this glucosamine and things like that. There's no evidence to suggest that they help with the arthritis. There's no evidence at all, and it is not recommended by NHS at all. The NICE does not recommend it at all.
And they are very expensive, and I
They
think
are
it's
very expensive. They are fancy kind of medication, and they have no role, not at all. And it's evidence based actually. Anything comes in front of NICE, it's evidence based, and NICE and categorically they have said that there is no role of it, and it should not be recommended to any patient.
Yeah, thank you. And if nobody have any questions, I think probably we can wind up our today's talk. It was excellent presentation, and it was very informative. So any questions from anybody before we close?
Dr. Tariq, I'm happy to share the slides. There are these important links. If people need that, you can just share the links. These are our personal Manchester Royal Infirmary Hospital links for videos. Some neck exercises, back exercises.